Hey, and welcome back to the Mindful Back to School Challenge for parents and professionals, all of us who are feeling a little burned out, stressed out, even as the school year has just begun. And also that reminder that actually for a lot of the kids we work with, school is actually their safe place. That kids who've been through adverse childhood experiences, maybe have some difficulties at home or in the past, that school is where they feel they're safest. And that who they need actually more than anything is a caring, compassionate adult who shows up for them. So even when we're not feeling at our best, to remember that the best tool for the kids is ourselves. The best trauma tool for the kids is ourselves. Right? When people ask me what's the best practice for kids, I'll often come back to, it's actually your own practice is what's going to help that child to regulate, because if you're regulated, our emotions are contagious, and then you're co-regulating with the child and they're actually in turn able to more effectively regulate themselves. So if you want stressed out, miserable kids, just surround them with stressed out, miserable adults. It's just that easy. If you want more mindful and compassionate kids, then we have to surround them with more mindful and compassionate adults. Now, I know it's not easy. Educators, I learned recently, actually before the pandemic, had higher rates of stress than emergency room physicians. And if you've been in a classroom lately or worked in a school lately, you know that that's only gotten worse in the last years since the pandemic. So learning to care for ourselves, the bio, the psycho, the social, right? What are you doing for your body, right? A little bit more eating mindfully, moving mindfully, getting the sleep that you need. What are you doing for your mind? Maybe it's practicing gratitude, using mindfulness. And what are you doing also in terms of your social world, the connections that you have? Are you trying to keep things positive or not in the workplace? But it's also about finding, I think, those little moments that can be helpful for you. As a therapist, I think about the ways emotions are contagious and kind of add up over the course of the day. I sit with an anxious kid and I think, oh my gosh, the world's gonna end. Or I sit with a depressed kid and I think, this kid needs therapist, he's in real trouble, right? Those emotions infect me and then they infect the next kid. I talk to, and this happens if you're a teacher as well, or you're coming home from a busy day at work, you bring that stuff home with you. I was talking to a doctor, John Fisher, he's in North Carolina, I think, and he was talking about using mindfulness for himself as a doctor as a kind of emotional disinfectant, right? Visit the patients in the hospital and then put on the Purell. But for us, teachers, therapists, parents, we need to emotionally disinfect before we walk in the front door. Emotional disinfectant between classes or even between clients that we're meeting with. So it's taking that moment before the kids trickle in. Can you feel your feet on the ground? Can you close your computer? It's taking that moment after that client or that kid leaves your office, close the door, feel it click, and just take a moment. Catch your breath, rest, place a hand on your heart, feel a little compassion starting to build back up again so you're not getting that compassion fatigue. Or as a parent I worked with actually, he had a very challenging special needs child. He's a really high stress parent and he would kind of race home from the office and his fancy Porsche SUV or whatever, and he'd get home and he'd sit in the driveway and he'd get in the driveway and he would just take 3 breaths in the driveway. And then he would walk in the front door and he'd say, you know what, Chris, I didn't always, get rid of the chaos when I walked in the door after I did that little disinfectant in the driveway, but I wasn't adding to the chaos. And so these are some of the little ways that we can the stress goes up and up over the day, right? We drop it back down. Notice sounds. Remind ourselves what we're grateful for. Right? Talk to a friend, reach out, reach in, that these are different ways that we can actually care for ourselves and give ourselves that emotional disinfectant so that we can show up and we can be that person in the child's life that even if they've been through some really difficult, challenging experiences, we can actually really be there for them. We can show up, we can be that attachment object that maybe they didn't have that will help them in turn to regulate. So it starts with us. It starts with finding those little moments for ourselves, talking about with our colleagues what's working, not just complaining about what's not working, right? Recognizing successes in the kids, not just this kid needs to do this and this kid needs to do that, right? All of these are so important in keeping us a little bit more positive, less burned out, so that we can be as present as possible. If you're a doctor, right, your presence is going to make a huge difference in whether the patients trust you and follow your recommendations. If you're a therapist, the best predictor of success in therapy is the relationship, the resonance between the client, the patient, and the therapist or counselor. If you're a teacher, we know the kids, who struggle with motivation, they're not working because they necessarily love the work. They're working for the teacher. Your relationship is going to make a difference. When you are that caring, compassionate adult in a child's life who is well-regulated, that is the best possible thing that you can give that kid, more than any of the breath practices that we'll learn this week. Mindfulness practices, SEL practices we'll learn this week, and that's going to be the best possible gift. So learning to care for yourself, the most important tool. With a few of these practices, we'll get started with more as we go.